Good morning and welcome to the Delco Show. This is Fiore, Executive Director of Delaware County's Brandywine Conference and Visitors Bureau, and just as a little side note, soon to be Destination Delco, and you are listening to the Delco Show on iRadio Philly. The Delco Show is brought to you by the Delaware County Chamber of Commerce. And before we get this started this morning, folks, with these two distinguished gentlemen, we need to thank our two hosts that take care of us down here at in media. One is the beautiful Primo Hoagies on Baltimore Pike in media that provides us with lunch every day. 3 hoagies. They becomes an adventure. We never know what they are. Maybe halfway through this program, we'll when we go to break, we'll know what they are. But so far, Stephen E. Kessler II, our erstwhile technician, is hiding that from me. I don't even know where they are in this studio here. And speaking of studios, we are in the beautiful Headroom, which is located right on State Street and Veterans Square in downtown Media. The trolley comes right by you here. Maybe you're going to hear it, unless Stephen E. Kessler cleans it up during the program. But the trolley runs right by us here. There's a lot of different restaurants, stores, boutique stores, jewelry stores, antique shops, artist shops, a lot of stuff right here in Media. And the Headroom is a unique experience. They rent you temporary facilities in one of, there's 7 or 8 or 9 rooms in here, including a fully state-of-the-art conference room that handles 10 to 12 people. They've got smaller private rooms, and they're temporary, and the costs are very reasonable, to say the least, indeed. And it's for people who are mainly working out of their homes and wants to get away from the wife or the kids or the dog or whatever it may be, or someone that's going to have a small conference and then they may work out of their home or a small office somewhere and need a larger facility to do it. So if you get a chance, check out Headroom. Check out Google their website. I believe it's headroom.com. It's a great place to do business. Convenient parking all around here in Media, the lots and the street and everything. And the facility is unique. They've done a great job in dressing it up. It looks very, very professional. So check out Headroom, and we're going to have our hoagies at lunchtime at Headroom. So, to say the least, indeed, here we go. We have 2 distinguished gentlemen with us today who have been on the Delco Show before, Dr. Richard Hunn and Dr. Stephen J. Weiss, who are from Mercy-Fitzgerald and Mercy Cardiology in Delaware County. It lands down at the Mercy-Fitz complex. It's the Mercy Health System, and also on Baltimore Pike in Springfield. And, it was a wonderful conversation I had with them the last time, again, about heart disease and heart valves and everything of that nature. And it's interesting. I mean, Dr. Hunn is a board-certified cardiologist who's been practicing in Delaware County for more than 20 years, and Dr. Hunn is the medical director of the Mercy Cardiac Valve Center. And Dr. Weiss is a board-certified cardiac surgeon with more than 20 years of experience, including having performed, which is amazing, more than 3,000 heart surgeries. Dr. Weiss is a Penn surgery who leads the heart surgery program at Mercy-Fitzgerald Hospital. Doctors, thank you for coming back and talking about this again. As I said, the last time you were here, we needed more than a half an hour to have this very interesting and very serious conversation. So welcome back to the Delco Show.
Thank you, Tori. It's a pleasure. Tori, thanks for having us back.
No, believe me, it's my pleasure, gentlemen. We talked earlier this year, we talked about the basics of the heart valve disease. They're back to talk about the health topic, more specifically as it relates to aging. And May is National Older Americans Month, so it's a fitting time to talk about this. So, since the last time you were here, and I think the last time that you were here, what we talked about, basically we talked about how far, heart surgery or heart technology has come since my father died in 1968, of what was then known as a coronary infarction, and how far it's come around. So we're talking about the heart valve disease and the aging population. What difference, I guess I would ask to begin with, does it matter whether you're 27, 37, 57, 77 when it comes to the heart valve replacement? Just go either way, guys. Jump right in.
It certainly does. Heart valve disease, in many ways, is a disease of aging. And One of our most common things we treat is something called aortic stenosis, where the aortic valve gets calcified and stiff and narrowed, and the heart has trouble pumping blood through it. And the older you get, the more wear and tear on your aortic valve, and the more likely you are to get aortic stenosis. In fact, something like 7% of all Americans over the age of 75 have aortic stenosis. And if it becomes symptomatic, it's very important that that valve gets fixed because it can shorten your life.
And Dr. Hunn?
Yeah, to expound on that, Tori, we're living longer as a population. The graying of America, the aging of the population, we're doing a lot better job with our primary prevention, and we're taking care of ourselves better. So with the aging of the population, we are seeing more of this valvular heart disease. Now, compounded with that is we have so much better technology, and we do such a better job taking care of patients now than we did years back. So a lot of the therapies that we may have said, nah, you're too old to have this done, or nah, we can't offer it to you. These therapies and treatments are now being available to our older Americans, so they can, again, live longer lives and live fuller lives.
Well, I think the last time you were here, we talked about the 4 types of heart valves that there are. Can we just do a little refresher course on that, doctors? Dr. Hunn?
Yeah, so to take it back, the heart is a pump, and it pumps out blood to the rest of the body. In this pump are different chambers, and those chambers are separated by doors that open and shut. Those doors are the heart valves. So you have 4 different chambers and 4 heart valves. Now, as I said, the valves open and they close. So they can have problems with opening, meaning the valves don't open well, or they can have problems with closing, the valves don't close well. So those 4 heart valves, really the 2 that primarily will get folks into trouble later in life are the aortic valve and the mitral valve.
Okay, so we've got those 2 basic simple things down. Now, I want to bring it home for a second, okay, and throw a little personal thing in here. So maybe this relates to it somehow, or if it doesn't, just tell me to shut up and we'll move on with the next part of the conversation. So, and ladies and gentlemen, we were speaking before we started the program because I have one hell of a tan. Okay, and they wanted to know where I got this tan. Besides the fact that my last name ends in a vowel and I'm Italian, Calabrese and Abruzzi, but I was in Florida for a week with 6 other Neanderthals and miscreants, and we had a week of total degradation without hard drugs. We never did hard drugs. None of us ever did hard drugs. We just drank a lot, and we ate improperly, to say the least, indeed. And I came back with, and I thought I had a stomach virus, doctors, okay? So here's where we go with the story now. I thought I had a stomach virus. I just wasn't feeling, So I tell my doctor, my family doctor, hey, look, when I'm not feeling well, I will call you. Don't pester me, okay? Every 6 months, come in, I'm going to take a blood test. So I called him because I said, I think I got a little stomach virus, okay? So I went to see him. They took a blood test. And the next thing I know, and that was on a Monday, the next thing I know, I'm being told to get to the hospital right away because my sodium level's down, and I also have CPOD. What the hell is CPOD or COPD or something like that? And he's telling me I got to get an inhaler or anesthetizer or something. So, tell me what that is and how does that tie into heart valve or anything like that? Anybody, help me here, because I'm pissed off at my doctor. I wasted 3 days of my life because I felt perfectly fine. No symptoms, no nothing.
All right. COPD is a problem with your lungs, and it comes often from smoking.
Okay.
It has nothing to do with heart valve disease.
Okay.
Except that people with heart valve disease often have COPD, and the symptoms of one are sometimes exactly the same as the symptoms of the other. And our job is to try to tease out what's from what and what's from the other. And that's one of the challenges that we face with valve disease.
Okay, so
and I think the problem with the sodium or the salt being low was probably you had a great trip, you were in the hot sun, and you may not have hydrated or had enough fluid, and if you had a little viral illness, you may have gotten a little dehydrated from that. So again, probably doesn't relate directly to a heart valve issue, but again, taking the point further, you didn't feel right, and you were smart at that point and said, look, I got to go and see my doctor and get checked out. And that's what we also tell our heart valve patients, that if they start developing symptoms or not feeling well, that they don't keep them to themselves. They don't try and self-diagnose. They get to their physician for an evaluation.
All right, well then, I'm 64 years old, okay? And I never had high blood pressure before. I always was 120 over 80, always. And now I'm on blood pressure pills. And I've been on them for 5-6 years. I forget how long it's been, because the doctor said I had high blood pressure. I don't know what the hell high blood pressure is. I'm not sure. I guess it's 140 over whatever, so I don't know. But now, since I went through this, it's up to 180 over 113. I mean,
well, I guess a couple of
is
thoughts.
That stress or hypertension?
A couple of thoughts about that. There, hypertension, high blood pressure is very common. It affects maybe more than 90 million of Americans. So you're talking about a very common ailment. It certainly is a disease that we see as folks age. As we age, our body changes a bit. Our arteries become a little bit more stiffer and thicker. And so it's not uncommon to see high blood pressure as we get older, as we age. There are other things that can affect your blood pressure as well. Environmental things, the salt in your diet, alcohol can do it, and really excesses of behavior and things like that. So again, not uncommon at times to see the blood pressure rise like it has. And you have to remember, you're not feeling well, you're sick. So the important thing is to get to your doctor, have evaluations. And, we have amazing therapies to take care of blood pressure, but sometimes it also comes down to improving some lifestyle things as far as diet and exercise.
Okay, well, that brings up my next question then. And let me go to you first, Dr. Weiss. I mean, is heart valve disease more prevalent as you get older? And if so, why is that?
It is. It is more prevalent as you get older, and the answer probably is wear and tear. Wear and tear. That we're really only designed to live, in our mid-40s or 50s when we were cavemen. And, we live on average in this country, I think it's 78 or 82 years, and your heart valves wear out. But, when you were telling your story about you're trying to decide whether to go to the family doctor, that's another of the challenges that we face with heart valve disease, because the symptoms of heart valve disease sneak up on patients, and they're not sure whether they feel bad enough to go to a family doctor or not.
Excellent point, doctor. Yes.
And then the family doctor sees them and perhaps figures out what's wrong, or perhaps not. Maybe they think it's COPD and it's really heart valve disease. And then they think they can manage this, and then it slowly gets worse, and they're not sure whether they should send the patient on to the next level of care, which would be a cardiologist. And similarly, when the cardiologist has the patient and they have more advanced heart valve disease, there will be a point where he or she needs to hand that patient off to the surgeon. And that threshold is sometimes hard to figure out. So I guess my message is, if you're having trouble breathing, or if you're having difficulty with activity that you used to breathe through when you were younger, it may not be that you're getting older, it may not be COPD, it might be heart valve disease, and the answer is easy. You get something called an echocardiogram. It's with sound waves, and there's no pain, and there's no radiation, and there's no shots, and there's no needles, and it's easy. And once we see the heart with the echo, with the sound waves, we can tell.
All right, well, when we come back, we're going to go to a break now, gentlemen. I want to get also into, I know there's a lot more we have to talk about, and we'll try to, get it all in, but I want to talk about, being active and how this could either help or affect, the problem. So when we come back from our quick break we're going to have here in about 20 seconds or so, I'd like to start with that question, because there's a point with that also. Ladies and gentlemen, we're talking to two very distinguished doctors, Dr. Richard Hunn and Dr. Stephen Weiss from Mercy Cardiology and Mercy-Fitzgerald Hospital. We're talking about heart disease and the effects it can have on the elderly. And as soon as we get back, we'll continue with the conversation. You are listening to The Delco Show on iRadio Philly. Ladies and gentlemen, welcome back to The Delco Show. As you should be well aware by now, I'm Torrey Fiore, and you're listening to The Delco Show on iRadio Philly. And it's sponsored by the delightful, the wonderful Delaware County Chamber of Commerce. We're speaking with Dr. Richard Hunn and Dr. Stephen Weiss from Mercy Cardiology and the Mercy-Fitzgerald Hospital Mercy Health System. Doctors, if someone would just give me a website, if anybody wants to look up Mercy Cardiology or Mercy-Fitz Hospital's health system. Mary Beth, who is their communications director, is here. So, Mary Beth.
Mercyhealth.org.
The website is mercyhealth.org. And Mary Beth, is there a phone number?
1-877
Hold it.
Go Mercy.
Hold it. 1-877
Go Mercy.
Go Mercy. You figure out the numbers in correspondence because nobody's used them for years. I still remember my Aunt Rita's phone number from South Philly, DeSoto 91009. But what do I know? Mary Beth, thank you very much. Appreciate it. Doctors, when we left the beginning of the show, I wanted to talk briefly before we get back on track here, and I don't know if I'm off track with this, about being active or not active. Now, I'll tell you what I do, but we can talk general. You know, I play golf. I still play, well, it's softball now, but I still play softball at 64 years old. I'm not the gardener, my wife is, but I move the rocks. For some odd reason, she thinks Italians know how to move rocks. That's what we're good for. And I do the what I call the ugly mulch. She does the pretty mulch, where she does the little digging because she knows where everything is. I get the garbage cans that I'm allowed to throw everywhere. So I do the ugly mulch. She does the pretty mulch. So I'm active, per se. My office, you know, I'm up and downstairs all the time. So I think that's active. But is it good sometimes, or is it you could be too active and it's bad?
So, Torrey, it's always good to be active. It's always good to be busy. You know, exercise is so wonderful for you and your health, and all the data has shown that exercise not only improves quality of your life, also can improve the quantity of your life. So all of what you're doing is great. A couple of points to that. Number one, if you haven't been active and you're looking to increase your activities, probably the smartest thing first is to get a checkup with your physician and evaluation to make sure that you're healthy enough to start, because many of us have been sedentary for so long. And the second thing is that if you have been active and you do notice a change in your symptoms, I'm starting to feel more short of breath, or I can't do what I normally had done previously, and that may be a sign that something is sneaking up, maybe a health issue, maybe a cardiac valve issue. So those are the things that we look for in our patients and to bring them back to us for an evaluation.
Well, again, gentlemen, what are the symptoms that, you know, could denote that you might have a heart valve problem, and how severe it would be?
All right,
Dr. Weiss.
We talked about the four valves and the four chambers, and we talked about leaky valves, we talked about narrowed valves. All those things have in common that they slow down the flow of blood through your heart. And if you slow down the flow of blood through your heart, well, maybe your blood pressure gets low, maybe you can't do the activities you used to do, maybe you pass out, maybe you can't breathe. That's how the symptoms arise. They're all caused by difficulty of blood from flowing through your heart because of the valves. And we love to find that problem because valves are easy to fix. You know, if your blood is not flowing through your heart because your muscle's been damaged from heart attacks or it's weak, that's much harder to fix. If you have normal healthy muscle and a bad valve and it's causing the symptoms of heart failure, which are shortness of breath, activity intolerance, passing out, chest pain, it's easy to fix.
So would you have to be, I'm trying to phrase this in the proper way. Does it have to does your doctor have to set this up, your family doctor, or is you as an individual? Could I go into the Mercy Health System or Mercy Cardiology and just say, "Hi, I'd like a workup," or whatever that, what's the cardiogram that you talked about prior to that, Dr. Weiss, the
echocardiogram.
Right. I mean, could I just walk in and say that and show you my cards and everything for my health plan?
Certainly, the best way to approach this is to approach your family doctor. Express all of your concerns, the symptoms that you're having. You can bring forth some of the information that we've talked about today, and certainly the availability that we have to see patients. We want to work as a team. We work as a team together, and work as a team with your family doctor. All that being said, we're available through the web, through the phone, and through other means. If you want to call and set up an appointment, we're happy to see anyone at any time.
Well, so but there's so many different. I guess what I'm trying to. There's just not one thing that causes this. I mean, we can talk all we want about the heart valve, but what changes in a heart occur? I mean, I like calcification, for example. That's just one of the examples, isn't it?
Yeah, I think you're.
I stumped them here, folks. No.
I think you put your finger on the crux of the problem. Okay, it is calcification of the aortic valve. It is wear and tear on the mitral valve. There's all these causes, all these things, but it is not one thing, and it creeps up on people. And people are not just ordinary healthy people that have one solitary problem. It's mixed in with all these other things, especially as we get older. Almost everybody comes to our hospital over the age of 70 has 4 diagnoses. During the break, you told us a story about a patient that had a sodium problem mixed in with a high blood pressure problem, mixed in with a bleeding problem, and he ended up being in the hospital for 3 days. And medicine is different than it used to be. It's changed in my career. There's not that one old-timey practitioner that knows you cold, that knows all your problems and says, "Oh yeah, his arthritis is acting up." You get put in the hospital, in the emergency room, when there's an acute problem, like this patient did, and the ER says, can we treat the problem and can we discharge him? Well, we can't treat the problem in one midnight. It's going to be 2 or more midnights, so we have to admit him. So then he gets admitted.
That patient was pissed off, Doc.
Okay. So he gets it.
Not mention any names, but he was a pissed off patient.
So he gets admitted to the hospital, and in the hospital they focus on the problem. They focus on, why he got admitted. They want to reverse that process as quickly as possible, treat it, and get him discharged, just like the emergency room does. But the other layer of it, let's figure out what caused that problem in the first place, that got left out. So he's now got to negotiate being an outpatient with now 2 new doctors to try to figure out on his own, and he's not even sure which is the more important. Is it the high blood pressure? Is it the breathing? Is it this third thing? So that's what happens to our valve patients. And that third thing in our patient's situation is valves. And we want to make sure that we don't lose those patients. We want to restore somebody that keeps an eye on all the valve patients, whatever else is going on with them or whatever doctors are treating them. And that's our valve center. That's our doctors. That's our coordinator. That's our navigator. Somebody that's going to keep tabs on you, just like that old-time family practitioner used to.
Where are they? Where's my old Dr. Wickus, who gave me a shot of penicillin and vitamin B and went his merry way, and so did I. Where is that guy?
They don't make them anymore.
Yeah, there's no more Marcus Welby, MD, like you had.
Oh, the hell with Marcus Welby, MD. I'm talking about Dr. Fred Wickus.
Right. He can't afford to be in practice anymore because he has to see twice as many patients as he used to stay even. And somebody's knocking on his door after 10 minutes saying, you got to see another patient. So he doesn't have the time to say, hey, did you follow up on this? And how come you didn't show up for this blood draw? But we do. Mercy-Fitzgerald made the decision, that hospital made the decision that we're going to put hospital resources into keeping tabs on everybody. And we're not going to just treat them in our ER and discharge them.
Well, he could fix anything.
Right. And this is Tori, this is complicated stuff. So if you say this is so confusing and difficult, it absolutely is. It can be confusing for patients. It can be confusing for family doctors. Heck, it's confusing for us, which is why, as Dr. Weiss said, we need to work together as a team. And the team is not only the physicians, we have a patient navigator to help coordinate through all the obstacles. And again, nowadays in healthcare, there are a lot of obstacles to trying to get better. And we're there to help to get through those obstacles because it is tough, it is challenging, and we need help.
Look, I'll say this much so far. I have gotten an education here because you guys have explained it in lay terms that I can understand. It's not all this magic gobbledygook stuff that you say, what the hell is that? Acronyms and everything. You guys are explaining it out, and I understand it. So, but I want to move on here because two other questions popped into my mind here. One, is there an age restriction on having a heart valve operation done? And number two is there, could you actually have it done as preventive medicine?
Both are great questions, and I'll start first. The simple answer to your question is no. There's not an age restriction. We don't look at a patient and say, well, you're a certain age, you can't have this or can't have that. Folks are living longer, as we said. They're living healthier lives. They're living vibrant lives later in life. So I never look at a patient and say that you can't have this based on age alone. All that being said, age can be a factor. So you need to understand the patient's age when trying to figure out what's the best course of treatment for that particular patient. So it's never a deal breaker, but it is one of the many factors that we look at when trying to devise the best treatment strategy for that patient. Regarding your second point, as far as prevention, in certain conditions, it is often better to attack a problem before it starts causing trouble. In other conditions, sometimes it's better to leave things alone. Again, it falls back to all of this being complicated stuff and really needing a good team approach to get to the right answer.
Okay, so and let me throw this back to you now, Dr. Weiss. And I'm going to try to make a common denominator or a comparison out of this. And I don't mind talking frank, and we'll try to do this fast because we have about 2.5 minutes left. My wife had breast cancer. She's doing great now. So I don't mind talking about this. Nice try saying we heard about this patient. Okay? Good try, doc. But anyway, and we went to one place. I'm not going to mention the name. And they wanted to do a double mastectomy to take out any chance of this coming back again. And it was like, whoa. Now, very important to us is the bedside manners. Now, then we ended up with Dr. Frazier out of Bryn Mawr Hospital. I don't mind mentioning Dr. Frazier's name. And he said to my wife, we're just going to go for the lump. That was 11 years ago. She's doing terrific. So is that the correlation? Sometimes you don't have to go that extra crazy step?
You want to find out the problem, you want to know the true nature of it, and then you want to decide together with the patient whether you need to go the extra step or not. My job is to educate you, or Dr. Frazier's job was to educate your wife so that she could make the best decision for her. She and he both had to be involved.
Okay. Yeah, I think to that point as well, often there's not one direct answer, and the real secret and the real trick in medicine is to come up to what's going to be the best treatment for that patient. As I tell folks, one size doesn't fit all. Which may have been better for Angelina Jolie may not have been as good for your wife.
Okay.
Doesn't mean one's right or wrong, but you have to find what's the best fit for you.
All right. Now, we've got about 48 seconds left. Mary Beth, give me the website and phone number again.
Mercyhealth.org.
Hold it. Mercyhealth.org.
1-877-GO-MERCY.
1-877-GO-MERCY. I think I got the numbers here. No, they're not the numbers, but it's the direct line. 484-494-4752. Dr. Weiss, Dr. Hunn, thank you very much. Mary Beth, thank you for the information. This was an education. And again, please come back because there's more to talk about. By the time we're done, we'll have an audio book. Okay? So let's do this again because it's intriguing. I get it. I understand it. So, Dr. Weiss, Dr. Hunn, thank you for being with us on the Delco Show.
Thank you.
It's our pleasure. You've been listening to the Delco Show on iRadio Philly. Thank you very much. See you next week.